I'm curious if you are with the FDA that went through all of these and rigorously looked at them, or as Surgeon General, if you're going to tell the truth to the American people.
To be able to have a thorough conversation with their doctor and know whether they are at
It-
higher risk for side effects when
saying
prescribed the
saying that
medication.
is one thing, but saying on different shows that birth control pills are a disrespect of life is very different.
I
Very
am
different.
passionate about
Very
women's
different.
health, and I think it is
Saying that the
disrespectful
people
to
use birth
women
controls like candy is very different than what you just said. Other
to
questions?
know
Let me move on. Thank
if
you.
a woman died from a
Dr.
stroke or a
Means,
blood clot because they did not have
thank,
a thorough
thank you for
conversation.
your answer. You made that clear. Let me go to another question. Thank you, Mr. Chairman. Thank you, Dr. Means, for being here. Let me start with this. You called birth control pills, and I'm going to quote, a disrespect of life. And you said Americans, quote, use birth control pills like candy. You also claimed, contrary to established science, that hormonal birth control has, quote, horrifying health risks for women. Now, here are the facts. There are 18 FDA-approved contraceptive methods, both hormonal and non-hormonal, and there are decades of evidence showing that every one of these birth control methods is safe and effective. So I wanted to ask you, help me understand, should women trust the FDA, which approved all 18 methods of birth control after a very rigorous look at the evidence, or should they trust your statement that there are horrifying health risks to birth control, which contradicts that evidence?
Thank you, Senator Murray, for your question. I'm curious if you're aware of what the side effects of hormonal contraception are.
I'm curious if you are with the FDA that went through all of these and rigorously looked at them, or as Surgeon General, if you're going to tell the truth to the American people.
I absolutely believe these medications should be accessible to all women. And also, all medications have risks and benefits. And in our current medical climate, with the burden on doctors, doctors do not have enough time for thorough informed consent conversations. Some of the horrifying side effects of birth control that I have mentioned include blood clots and stroke risk in women who have clotting disorders, who are smokers,
So
who
is
have
it
obesity.
general?
No, it's not general. I'm very careful with my words, and when I say those comments, which are taken out of context, I'm speaking about particular women that can be hurt if there is not informed consent about their medical history, their lifestyle exposures, and their family history. I want those women, and I know you do too, to be able to have a thorough conversation with their doctor and know whether they are at higher risk for side effects when prescribed the
Saying that
medication.
is one thing, but saying on different shows that birth control pills are a disrespect of life is very different.
I am passionate about
Very
women's health, and I think it is
Saying that the
disrespectful
people
to
use birth
women.
controls like candy is very different than what you just said.
We prescribe a huge amount of hormonal contraceptive, and I do not believe most of those conversations have informed consent because of the pressures that doctors are under because of our broken healthcare system. I want what's best for women, as do you, and I want every woman who could be at risk
I just
for a
have
side
2 minutes
effect
left and I have other
to
questions.
know
Let me move on. Thank
if
you.
a woman died from a
Dr.
stroke or a
Means,
blood clot because they did not have a thorough
thank you for
conversation.
your answer. You made that clear. Let me go to another question. Tracy Beth Hogue, she's an anti-vaccine skeptic. She was elevated by the Trump administration to serve as the top drug regulator at FDA. She made comments last week casting doubt on the safety of RSV vaccines for baby. As you I'm sure know, RSV can be deadly even for healthy full-term infants. Do you believe that Dr. Hogue is wrong to question the safety of RSV vaccines?
I have not read that article or seen that quote. I would need to know what she said before I commented on that.
Well, you do know that RSV is the leading cause of hospitalization for infants.
I have a 17-week-old, and I'm very aware of that.
You hear her statement as Surgeon General. Would you contradict it?
I certainly have absolutely no issue having very frank conversations with anyone in the administration if I believe that their statements are misguided in some way or not fully informed. That's not a conversation I would have publicly first. I would have a private and direct conversation with anyone in the administration if I felt that patients were at risk because
All
of
right, and I
use.
also want to ask you about maternal health. Mental health conditions are the leading cause of maternal death in the U.S., including suicide and overdose deaths. In her comments last week, Dr. Hogue, same woman, also expressed concern about the safety of the antidepressants during pregnancy. Specifically, she called out SSRIs, the most commonly prescribed type. Do you believe that SSRIs are dangerous for pregnant women?
I don't want to be a broken record here, but I do believe that every medication has risks and benefits, and you need to have a nuanced conversation with your doctor before starting a medication. That is, I think, the most responsible position for any doctor to share.
Well, strong evidence has shown that SSRIs are safe in pregnancy. Most do not increase the risk of birth defects.
Certainly.
But untreated
Certainly.
depression in pregnancy puts women at risk.
And I agree with you, but I still think a patient, I don't think it's responsible to make a blanket statement for all Americans.
Okay, well, if confirmed as Surgeon General, it will be your job to give accurate and up-to-date health information to the American people. I assume you will take that
I will.
responsibility seriously.
I absolutely do. And I also believe that the American people are looking for a more nuanced conversation about health. And I believe that that will help restore trust in public health.
Thank you.
Times of India videos, your daily dose of India and the world. Global news, different views, and sharp analysis.
Pressure of expectation from your fans, your supporters.
That has often served as a backdrop for several Bollywood.
You're not a brute majority anymore. If you individually take out playwright.
Making sense of global conflicts. Tracking the new emerging world order.
Strike on Israeli military bases.
A multi-pronged.
To stay out of harm's way as Israel started bombing targets across.
Understanding changing alliances in a polarized world. Tune into TOI videos for all this and more. Click on the bell icon to subscribe and never miss an update.